standing as the cultural vanguard of West Java, Indonesia, nourishing the intellectual life of the nation, working for the benefit of the global world. This is Universitas Padjadjaran. Inspired by the vision of the Asia-Africa Conference, attended by representatives of 24 countries, the establishment of the university was the realization of the vision of the cultural figures of West Java to found an institution of higher learning in the cosmopolitan city, to educate and set forth to society dedicated and qualified individuals. Today, UNPAD has broadened its wings to encompass various disciplines and multidisciplinary academic endeavors through the efforts of 16 faculties and 1 postgraduate school. To achieve its mission to build the capacity to adapt and innovate in the face of the rapid development of science and technology at the international level, UNPAD is determined to become the center of research and innovation for the good of the nation and the world by continuously nourishing research and developing technology to create innovations in various disciplines. Currently, 36,000 students are registered at UNPAD, and more than 200 international students are registered in different programs, degree and non-degree. As an effort to constantly improve the quality of education, Universitas Padjadjaran is supported by approximately 2,100 professional faculty members with reputable qualifications. To achieve the goals of its mission, UNPAD has also established notable research centers, which demonstrate serious commitment to and focus on achievements in a number of strategic fields, such as the Center for Sustainable Development Goal Studies, the Center for Environmental and Sustainability Sciences, the Academic Health System, the Center for the Digitalization and Development of Sundanese Culture, the Center for Innovation and Pharmaceutical Services, the Center for Nanotechnology and Graphene Research, to name a few. Equipped with a central science laboratory network and a science and technology complex in the Center for the Development of Science and Technology on the main campus, Universitas Padjadjaran has risen in its role as a leader in higher learning geared towards innovation. UNPAD also fosters collaboration with other institutions involving all stakeholders.
Universitas Padjadjaran commits in providing benefit and service for the good of humanity and the preservation of the environment. This is a great enterprise which cannot be done alone. UNPAD believes that in the spirit of collaboration, this vision may be achieved. We invite you who have the same vision, a good intention to care for human life and the environment all over the world, to work with us, build collaborations, create a better world together.
Universitas Padjadjaran grew out of the community and has made it its duty to give back not only in the form of the dissemination of knowledge and information, but also through socially responsible activities such as student fieldwork, community outreach programs, and action research seeking to make direct impact on the community. With its feet firmly grounded in the local communities and environment, UNPAD is also making great efforts to take steps towards internationalization. It offers special programs for international students to maintain its global network and make its strategic and reputable place on the world map of higher education. As a site for the personal development of young minds and bodies, UNPAD supports a wide variety of student activities. UNPAD also provides students with libraries with an extensive collection of books periodicals and study materials, comfortable dormitories, health and fitness services, free on-campus transportation, and other supporting facilities which UNPAD continuously upgrades and improves. While being committed internationally recognized quality research, UNPAD maintains also its dedication in preserving traditional cultures as the compass for all of UNPAD's activities on and off campus. As of now, UNPAD have set forth unto society 200,000 graduates in various fields of work, including strategic government sectors and crucial multinational industries. Works for the good of society, bringing innovations and sincere contributions to humanity. Universitas Pajajaran, the pride of West Java, working for the benefit of the global world.
Okay, doctor. One more video.
Expert from around the world, and you can learn this for free while gaining 3 credits. Come join our online course in collaboration with Faculty of Dentistry Universitas Pajajaran and Smart Train.
Okay, so that's all the video that we have to watch before the session. And greetings from Transcendent 2021, massive open online course in cleft lip and palate held by Faculty of Dentistry Universitas Pajajaran, collaborating with Smile Train and Indonesian Cleft Center that has been going on for a few weeks. My name is Shiva Biandra. I'm a student from Faculty of Dentistry Universitas Pajajaran, and I will lead today's live discussion. I see that we came from different countries, so it's appropriate to say good morning, good evening, and good afternoon. Greetings to Dr. Karoon Agrawal, Master of Surgery, Senior Consultant from National Heart Institute, New Delhi, India. Thank you for being here, Doctor. It's been an honor, a pleasure, and we really appreciate your presence here. How are you, Doctor? Sorry, Doctor, you are still muted. Your microphone. All right.
Good morning, everybody.
Good morning, Doctor.
Thank you, Shifa, for inviting me.
All right. Greetings to all the participants. Thank you for participating in this course, and thank you for attending this live discussion session. So, Doctor, today is our second live discussion for the 5th week, and we are going to discuss about COVID-19 and the impact of COVID-19 to CLP surgeries, and about the orthodontic treatments for CLP patients in the next 2 discussions. So today we are going to discuss about the impact of COVID-19 on cleft surgery in the year 2019. This live discussion will be separated into 2 sessions. In the first session, Dr. Agrawal will be answering the questions that have been filled out by the participants in the MOOC website. The question will be presented on the screen. The participants have already watched the lecture about the related topics, the impact of COVID-19 on cleft surgery in the year 2020, but I think not everyone can make it into this live discussion. But I'm pretty sure that other 300 participants that have registered into our course will watch the recorded video. In the second session, the participants will have the opportunity to ask to you directly through the comment section, or they can unmute, and the participants should write the question, their name, and their institution. So now we may start the first session. Please present the screen, committee. So the first question, doctor, is there a certain maximum patient in a day who is undergoing primary surgery during this pandemic in your cleft center?
Yes, we normally do maximum 2 primary cases in a day during pandemic. And before pandemic, we used to do almost like 3 to 4 primary surgeries in a day, because we used to run 2 theaters and we used to do 2 cases in each theater. But because of pandemic, we restricted the number of patients because our healthcare workers were limited, the surgical possibilities were less, the anesthetists were less, and we did not want to take any chances of crowding. So in one day, in our hospital, we do maximum of 2 primary surgeries. And the recommendation from international community like American Society of Cleft Palate Society also recommended that we should restrict the number of primary surgeries in a day, so that we do not have too many patients in the ward, too many parents in the ward, and not much of movement of the people around, so that the risk of COVID transmission is less and healthcare workers are also not affected. And also I would like to tell that between 2 primary surgeries, we spend almost 1 hour in the operation theater to make it clean, for the change of air, for the change of equipments and instruments and all the mattresses and sanitization of all the infrastructure in the theater, so that there is very little possibility of transmission because of presence of virus in any of the equipments or the instruments or through healthcare workers. So that's how we try to limit our patients and try to avoid transmission of disease through surgical activities. So that's what we had our limitations. And we noticed that not a single patient till now in our hospital, anybody had positive COVID at the end of surgery or after discharge. Thank you.
Thank you, Dr. Agrawal, for the answer, and thank you, Kanza Zahira from Universitas Padjadjaran for adding this question. So it's amazing to hear that there is no COVID-19 case post-surgery in your cleft center, and I hope in the future it will stay like that, doctor.
Yes, Shifa, thank you.
And the second question from Hasna Faza, Universitas Padjadjaran. Was there any case in India where the doctor got positive after finishing cleft surgeries?
This is very interesting question. As far as I know of the Indian scenario, amongst doctors, no cleft surgeon got COVID after the surgery. And simultaneously, I do not know of any incidents where anesthetist got COVID after cleft surgery. However, there is one center in Western India, Pune, where one of the nurses in the hospital had COVID, who was working in cleft center and had very severe COVID after some of the cleft surgery cases. But it is not sure in that nurse also that it was transmitted from any cleft case who had COVID, because as per protocol, we did not allow any surgery to be done on cleft patients who is COVID positive. So there is no chance of transmission of COVID from cleft patient to healthcare worker in the hospital. And this nurse was working in the hospital for quite some time, and it is not sure that it was transmitted from any of the patient in the hospital or it was transmitted from any other visitor in the hospital. So I'm not sure. But coming back to the question that any doctor, to my knowledge and to my information, there is no doctor, anesthetist, or the surgeon or medical officer got affected after finishing the cleft surgery. That's the shortest I can give answer. And I'm keeping a track of all the cleft surgeries performed throughout the country, being the member of the Indian Medical Council of Ismail Train. So I'm aware of most of the cleft surgery activities throughout the country. So I'm sure there is no transmission of COVID to doctors from the cleft patients. Thank you.
Thank you, doctor, for the answer. So it's really hard to track because hospitals and cleft centers are high risk, right, doctor? And as far as you have implemented 5P, right, doctor? In your lecture, you mentioned about 5P.
Yes.
It is safe to do cleft surgeries as long as it's according to the protocol and the guidelines.
Yes.
Next question, please. Number 3, from Farshad Sabita, Universitas Pajajaran. In this pandemic, more people are affected financially. Does this problem increase the occurrence of cleft lip and palate case? Thank you, doctor.
Very interesting question. In this pandemic, more people are affected financially. Does this problem increase the occurrence of cleft lip and palate? I don't think the incidence of cleft lip and palate will increase because of this financial constraint during pandemic. Rather, to my assessment, the number of children born during this pandemic or immediate after pandemic will be less because of so many reasons, because of the infection, because of the financial problem, because of migration, because of psychological problems, mental problem, and people getting, the family members getting COVID, and then some of them dying, some of them have got severe illness. So likely that the number of children born will be less in total. And hence the number of cleft lip and palate children born is also likely to be less. That's my assumption, but I'm not sure because I do not have data. But I do not think this financial problem will create more number of cleft lip and palate children, because we know in developing countries, we have population with financial constraint to a large extent in many of the developing countries. And the incidence of cleft lip and palate remains around 1 in 700 live births. And probably this is going to continue. Another thing is our government most of the governments have taken care of the people who are financially affected because of the COVID to a large extent. I don't say that they have compensated fully, but they have taken to a large extent. A lot of NGOs have come into to help the people, and government, state government and central government has announced a lot of subsidies and financial help. So the financial aspect will be taken care to a large extent. So in brief, I personally do not feel that number of cleft incidence of cleft will increase because of the financial constraint following pandemic.
Okay, doctor, thank you for the answer. So because of the decrease, the expected decrease of number of baby born, the incidence of cleft lip and palate might not increase. Maybe Farsha asked this because in some lectures, it was explained that economic factors that leads to malnutrition could cause cleft lip and palate, so that the person who asked the question asked that question.
Okay.
I think that is the connection behind that.
Okay.
So to the next question from Faras Reza, Universitas Pajajaran. So in your lectures, you explained that anxiety is one of the most common thing that you find in the patients and also in the family. So how do you manage anxiety in patients because of the postponed surgery in the pandemic? Thank you, doctor.
Yes, Shifa and Farshia, this is a good question, and I had to some extent answered this question in my presentation towards end. And during pandemic, how do I managed? Actually, we managed through telehealth and teleconsultation to a large extent. And even those who are registered in our hospital, as well as most of the cleft centers in our country, they had connected to the parents through telehealth and teleconsultation. And I personally used to have every day 1 hour session on WhatsApp as well as the Zoom with parents and caregivers of the cleft children to take care of their anxiety. Also, we wanted them to be supported that delay of cleft surgery by a couple of months or a few weeks will not affect in the overall result. Especially the cleft lip will not cause any problem at all. And we had little hard time about the cleft palates that delay by a few months will not affect much, but we could convince them to wait for 3 to 4 months without any compromise in their speech or the functional outcome. So a lot of things have happened, and there has been a very good advantage of facility of online consultation and online caregiving. Another thing which has happened is a lot of speech therapy could be imparted through this telehealth, because that's one of the care which can be imparted very well through telehealth. Another thing we could help was in the nutrition consultation. And it was almost a regular feature. Almost 3 days a week, we used to have consultation for our with our parents. And it used to be very helpful, and their anxiety we could bring down to a large extent with this telehealth facility. Thank you.
Thank you, doctor, for the answer. So telehealth has been helping in managing anxiety in patients and the family, right, doctor? Okay, next question, please. So this is a question from Josefinda Ayu, Universitas Padjadjaran. Hello, doctor. Are you having some issues in your Zoom? All right. So may I continue, doctor, with the question?
Yes, please. Please, Shifa.
Well, we know that there are new variants of COVID-19, and one of them is Delta variant. Does this new variant provide new challenges or make existing challenges more difficult to overcome? Or maybe you can tell us how this new variant affects cleft surgeries in your country. From Josefinda Ayu, Universitas Padjadjaran.
It's a very difficult question, because the cleft surgery does not follow any variant of the COVID. Only thing is, we are worried about this variant in the sense that it is more infective and severity is likely to be more. So we have not, the cleft surgery is not affected based on the variant, or the decision about the primary or secondary surgery is not dependent on. Is it audible?
Yes, doctor. I can hear you, but not now.
Is it okay?
Yes, now I can see you and I can hear you clearly.
Okay, so the variant, we are not concerned about any of the variants of the COVID, and hence the cleft surgery is not dependent on the availability of report of the any type of variant. We could notice that Delta variant was detected in India, and now in many of these states, the number of Delta variant is increasing in our sequencing and analysis. But we are not concerned. And as such, the number of cases throughout the country is going down. Hence, most of our services have opened, and even the cleft surgeries have been being performed to a large extent in most of the centers. So variant has got no relevance in performing cleft surgeries, either primary or secondary, though I can say that we are mainly doing primary surgeries and secondaries are still not very much encouraged. So one should not worry about the variant as of now, I suppose. Thank you, Shifa.
All right, doctor. So the variant is not really, it does not really affect because COVID-19 is already dangerous and need a lot of guidelines and protocols, right? That's the point of all these variant and surgeries, right, doctor?
Yes, yes, yes.
So
Yeah.
I actually have a question for you, doctor. From your lecture, you said that surgery resumed in many countries with 5Ps, which are prioritizing cleft procedures, preoperative screening of the patients and the parents, providing clean and safe hospital environment, protective methods for healthcare workers, and preventive measures by the parents. And I also saw in your lecture that it's up to a partner hospital to make their own protocols whether to do surgeries or not. Can you tell us more about your daily activity in your cleft center, maybe before a surgery? What are the things that you do in the middle of this pandemic? What changes?
Yes. A lot of changes have occurred in my cleft center since the pandemic has started. Earlier, we used to give appointment to large number of patients as and when they wanted to come, maybe 10, 20 patients, as many are available, we used to allow them to come to our hospital. And we used to have individual programs, we used to have group activities, we used to have group activities of nutritional counseling, we used to have group activities on speech counseling. But now, because of the pandemic, there has been a lot of turnaround. One, we do not give more than 4 or 5 appointments in a day. And they're all scheduled at the gap of 30 minutes, each one of them, so that one patient does not meet the other patient and not more than 2 patients are there in our reception area. Second, all of them, the patient as well as the parents and the accompanying persons, all are screened at the gate of the hospital for their temperature and for any illness they have. If there is any illness or fever to the extent of 99, they will be referred to a fever clinic, which is adjacent to the gate, where one medical officer examines. Any doubt is there, they are not sent to our clinic. They will be sent back home and they will be requested to come back after 5 days or a week. Second thing which has happened is when they come inside the room, not more than one person is permitted to examine the child. And while examining, I do not put the PPE kit. However, I always use double mask. I use goggle and I use shield while examining the child intraorally. Shifa, am I live?
Yes, I can hear you clearly.
Oh, because I could not see you, I thought.
Oh, yeah. No,
Okay.
I can hear you clearly.
So there is a change at the gate, entry of the patients in the reception area. And when they enter, preferably one parent is allowed with the child. And if the child is so difficult to manage with one parent, then we allow 2 parents who sit quite away from my chair. And while examining the intraoral of the child, I always put on shield. And they Earlier, we used to allow them to come 3-4 times before surgery for counseling, for speech counseling, for investigations and pediatric checkup and other things. But now, on first day itself, we examine clinically, we send to pediatrician same day, and we do the investigation same day, so that they come only for pre-anesthetic checkup and admission next time. And that is the clinical part. Then during surgery, earlier we used to admit the child indoor one day before in the afternoon and operate in the morning and discharge after a day or two. But now, since COVID is there, we do not want the children and the parents to be there in the hospital for long. So we admit our children in the morning around 6-7 o'clock and operate at 9 o'clock and 11 o'clock, 2 cases, and keep them overnight. And next day morning, we discharge the children, whosoever is possible to go home. And if they are from too far, then we keep for another overnight and discharge after 48 hours. So this is the major change which has occurred during pandemic. Only aim is not to have too much of interaction, not to allow them to crowd, and they are not exposed to many healthcare workers for too long to prevent the infection. Hope I'm clear about my schedule about the cleft surgeries. And I'm not doing any endoscopic procedures. I'm not doing the secondary procedures at the moment.
All right. Thank you, doctor. So I hear from your explanation that there are actually silver linings to this condition, because the patients do not need to visit for 3-4 times before the surgery, right, doctor? Everything is done in one day and then go for the pre-anesthetic. I think it's easier for the patients and also for the health workers to reduce the risk of COVID-19. So doctor, there is one more question from Kanza Zahira, Universitas Pajajaran. So how effective is teleconsultation on the success of post-operative care? How can the patient's parents keep up with the treatment?
Yes. Very good, Zahira, for this question. This teleconsultation is very effective in pre-operative period, and it is very effective for nutrition care. It is very effective and useful in speech therapy and speech care. But post-operative management of the surgical children, the parents are not very happy with the teleconsultation. They want to visit at least once after the surgery to see surgeon and to have a personal look at the child after the surgery. That's why I always call all these parents after a week. In cleft lip, if I have to remove the sutures, I remove the sutures on that day. Cleft palate, I examine the child for the condition of the palate. And they will have many questions related to medications. They will have a lot of questions about giving bath, cleaning. They will ask for nasal discharge. They will ask for so many questions are there, which even if we want to answer on telephone or WhatsApp, they are not very much convinced. So I think for post-operative period, I will like to have all my children at least once, and if possible twice, after a week and after 15 days, because we start normal diet after 14 to 20 days of the surgery. So mostly I try to see these children twice, after a week and after 3 weeks. So that's my regime. However, if any intelligent parents are there who are ready to accept the teleconsultation, I call only once, and then I prime them that you don't need to come. We can have consultation telephonically and you can manage the child at home. If any physical problem is there, you are always welcome. So this question is quite pertinent in today's situation, because Zahira must have faced this situation. That's why she has asked a very pertinent question like this. Thank you, Shifa.
Thank you so much, doctor, for the answer. Yes, sometimes the parents get anxiety, like according to your lecture too, when they cannot see the surgeon, right, doctor, after an operation, even though maybe the children does not have any problems, but sometimes it's assuring just to make the surgeon see directly, not from this a screen, right, doctor? So next question is from Rashid Abdul Aziz, Universitas Pajajaran. This is from the chat, from the one of the participants in this Zoom meeting. So the emergence of the COVID-19 had a large impact on general healthcare system. One of the impact is a decreasing number of surgery rates, including CLP surgeries. What do you think about this, and how will it impact the untreated patients in the future? Will it cause more problems? Thank you,
Yes,
doctor.
yes. This is Rashid, isn't it?
Yes.
Yeah, very good question. And I try to answer this question in one of the slides towards end of my presentation. And this is a major issue which most of our healthcare givers and administrators are worried about, because COVID-19 has affected not only cleft lip and palate, it has affected all types of surgeries other than very emergent surgeries. It has affected general surgery, it has affected pediatric surgery, it has affected neurosurgery, cardiac surgery. It has affected all types of surgical disciplines. And there is a huge backlog. You could see that 25,000 plus cleft children has become a backlog in 2020. As of now, in 2021, another 15,000 children backlog has been created. So you imagine 40,000 surgeries are backlog in primary cases, and almost like equal number of secondary cases will be backlog. As such, most of the low income and middle income countries are reeling under the pressure of too many patients, less finances, less infrastructure, less manpower in routine pre-pandemic. And now this pandemic has brought in a large number of backlogs. And that too, untreated patients who are delayed by a year or two, which may require little more of an exercise to treat these patients. So it's a big challenge for all the governments, not only my country or your country. It's a challenge throughout the globe for all the countries, even developed countries. If you see the developed countries, European countries, American countries, they have got so much of COVID effect that they had stopped all sorts of routine surgery and semi-emergency surgeries for 2020, as also in the first part of 2021. So this will be a challenge. All the governments have to decide how these can be treated, and they have to draw at two levels, at the country level as well as WHO level, and they have to plan. They have to plan the pre-operative protocols, they have to plan the research, they have to plan the investigations for these patients, and surgery and anesthesia. So it's a big job to be done. Also, WHO has to give guideline for them so that all countries can follow some system. And every country, every Ministry of the Health and Family Welfare in each country need to think of infrastructure, workforce, care delivery, information management, financing, and governance of all the hospitals for providing care to all these backlog patients as well as new patients emerging. Hope this is, I can give a speech on this for hours, because this is very important insight of all the people who are examining the backlogs and the effect of COVID on elective as well as semi-emergency surgeries. So this is in a nutshell I can think of.
All right, thank you, doctor. So yes, the backlogs are in the new normal. It will be a bigger change, right, doctor? So I think it is the time for increasing the quality of local health workers, right, doctor, to face the backlog in the new normal in the future.
Yes.
One of them is by joining this course, everyone. So is there any more question from the participants? I think that was the last question for today. And doctor, before we end this live discussion, I wish you could say maybe a thing or two to us as the future of health workers that will face the backlogs from this COVID-19, the impact of COVID-19 in the semi-emergency surgery, or this one of them is cleft lip and palate surgeries. Is there anything you want to tell us, or maybe some advice? It will be very good, doctor. Thank you.
Shifa, my advice may not be so important, but I will say that, especially we are talking of cleft lip and palate. In general, as I said, every hospital has to take decision. Every state government has to take decision. Every central government has to prepare a guideline to take care of all the general patients. As well as cleft lip and palate is concerned, we have to give priority to primary surgeries. Even if backlog is there will be backlog of primary surgeries, there will be backlog of secondary surgeries. Amongst all of them, first thing, we have to give priority to cleft palate surgeries. Second, we should give priority to cleft lip surgeries. Amongst all the secondary surgeries, I think what is important is the cleft palate fistulae and VPD. These surgeries need to be given priority over other cosmetic surgeries like lip revision, rhinoplasties, and orthodontic surgeries. However, in this sequence of surgeries, one should always, even if pandemic comes down, one should not lower the guard for prevention of the disease. One should always take enough precaution till the WHO announces end of pandemic and the COVID becomes zero, which I am not expecting in near future, which may take a year or two. Till then, we should not lower our guard. Take care of ourselves, especially surgeon and anesthetist. We should take care of the healthcare givers in the ward, in the operation theater, as well as clinic. We should take care of parents, and we should guide them, counsel them adequately, and give a lot of psychological support. I see a lot of role of psychologists and psychotherapists in post-COVID scenario, even in cleft lip and palate care. To tell you the fact, I have inducted one psychologist now in my clinic who is calling almost all the patients, even after surgery, and trying to help as much as possible psychologically. And she meets only 2 patients physically in a week on Saturdays, and rest of the patients are given online consultation. And that has helped a lot to parents, those who are waiting, especially secondary surgeries, because we are performing primary surgeries. We are not performing secondary surgeries. So those who have undergone orthodontic treatment, waiting for orthodontic surgery, waiting for ABG, they are all worried that will it be done? Even if it is done, will it be done properly? And will it be useful in future? So I think there is a lot of role of psychologists. There is a lot of role of personal attention by the surgical team and caregivers to parents. So that is challenging. So apart from doing surgery and giving the medical care, we need to support mentally as well as psychologically. That's what my conclusion is in this remark. Thank you, Shifa. Hope it is quite relevant to your question and conclusion.
Thank you, doctor. So it is really insightful. We have to pay attention to the mental health of the patients and also the family of the patients, and it will be one of our main focus regarding this situation. So thank you, Dr. Karoon Agrawal, for today's session. It was really insightful and really interesting. It was a really good opportunity to hear your valuable knowledge. And in this hard time of the pandemic, we can still find the bright sides. I believe this live discussion would be an inspiration for all of us to learn more about cleft lip and palate. and to implement the best treatments to our cleft patients, no matter how hard the challenges are in this pandemic. And don't forget to take your precautions every day. Thank you so much, everyone. Thank you so much, Dr. Karoon Agrawal and the participants. Before we close the session, we will have a photo session first. So please, committee, and also turn on your camera so we can take a picture. I will count and then the committee will screenshot the screen. 1, 2, 3. 1, 2, 3. One more. 1, 2, 3. Okay. Thank you so much, doctor. Thank you so much for the participants. Goodbye and stay healthy, everyone.
Thank you, Shifa, and thank you, everybody.